Hello everyone and welcome to Inside Healthcare. Diabetes is a growing epidemic in Minnesota and in this country. Type 2 diabetes in particular is becoming so prevalent that chances are you or someone you know has been diagnosed with it. Minnesota and national health officials estimate there are as many as 1 million of the 4 million Minnesota adults may have already pre-diabetes and not even know it. The health impact of diabetes and pre-diabetes is alarming. If you have diabetes, you are 2 to 4 times likely to die of heart disease, 2 to 4 times more likely to have a stroke. 24% of Minnesota adults with diabetes report having depression, and in Minnesota, 44% of persons with diabetes report having arthritis, and diabetes is also one of the leading causes of blindness and amputation in the United States. Joining us to talk about diabetes, we're very pleased to have back with us Marsha Hughes. She's Director of Community Health Improvement. Thank you, Marsha, for being with us.
Thank you, Jody, for having me.
It is so alarming, diabetes. Maybe if we can just take a step back first, what exactly is type 2 diabetes? What is pre-diabetes? And what's the difference and what would be some of those things?
Well, diabetes is a chronic condition, and it is when glucose levels or blood sugar is too high in the bloodstream, and a diagnosis of diabetes is made. There are different types of diabetes. Type 1 diabetes is when someone is no longer produces a hormone called insulin. Insulin is necessary to move the glucose from the blood into the cells. They require insulin right from the very beginning. Gestational diabetes is prevalent during pregnancy. And another type of diabetes, which we're focusing on today, is type 2 diabetes. It's much more common. Probably 95% of people that have diabetes have type 2 diabetes.
So when someone says they have diabetes, more likely it's type 2?
It's type 2 diabetes. And that's related to how our body uses insulin. Our body still makes insulin, but our body becomes resistant to the insulin. There does seem to be a genetic factor with type 2 diabetes. And it also seems to be related to inactivity and being overweight are risk factors for type 2 diabetes.
And what about pre-diabetes then?
So diabetes, type 2 diabetes doesn't come on overnight. It is a progressive situation with the bloodstream. And it's been estimated that a person can have pre-diabetes 6 to 7 years before a diabetes diagnosis is made. So it's related to the progression of blood sugars over time. So we're learning a lot today about identifying people that have pre-diabetes, and there are some interventions that can be done to halt or delay diagnosis of diabetes.
I was surprised to read that nearly half of all the people over the age of 65 may have pre-diabetes.
That's right. If the current rate of diagnosis continues, 1 out of every 3 people will have diabetes at some point in their lifetime. And pre-diabetes, especially if you're 65 and older, half of the people fall in that category. So we're really, really interested in identifying people that have pre-diabetes because we have an opportunity to delay or decrease the risk of getting diabetes.
What would be the symptoms? Are there symptoms?
Well, that's the challenge, is that there really aren't any symptoms of diabetes, of pre-diabetes. And even diabetes, your blood sugar has to be fairly high before a person has symptoms of diabetes, which would be fatigue, frequent urination, very thirsty. Those are the typical symptoms of diabetes, and a person's blood sugar is probably well over 200 by that time, and normal blood sugar should be between about 100 and 140. So pre-diabetes is identified before a diagnosis of diabetes is made, and so therein lies the challenge. There aren't any symptoms associated with pre-diabetes.
So with no symptoms, someone may just go in for an annual checkup, and the blood test may show that the blood sugars are running a little bit higher?
Yes, and I often hear people talk about, yes, my doctor has mentioned to me my blood sugars are a little bit high, and we have to keep our eye on it. So I think our providers are looking for it, but now we have some prevention. We've got some programs to help prevent diabetes.
I think that is the good news, that it can be reversed if you start making some lifestyle changes and things like that. Why don't you tell us about HealthEast is introducing or launching a number of prevention programs. What are those?
Yes, HealthEast is expanding its diabetes prevention efforts. And one of the things that we've done, we have applied for the Centers for Disease Control. They have a national diabetes prevention program. And so we are a certified site to provide this program. The program consists of 16 weeks. It's 1-hour weekly sessions, and it's really based on lifestyle change. There's a well-established research study that was done on 3,000 people that if people lost just a little bit of weight, 7% of your weight.
Which isn't a lot.
It's not very much. That might be, even 10 or 15 pounds for many people. And if they become more physically active.
And what would that mean?
Well, it's defined as 150 minutes a week. So 30 minutes, 5 days a week.
Again, not a lot of time.
Not a lot of time. And this program introduces 16 different topics. And then people go for a week to practice the topics and come back together. And when people completed the program, they reduce their risk of getting diabetes by 58%.
Wow.
And people that are 65 and older, their risk for getting diabetes was decreased by 71%. And that was over 3 years. It really is amazing. And so we have a fantastic opportunity to really identify people that have prediabetes and get them into the program.
And you have some other programs as well, too.
Yes, and at this point, too, we've got the state of Minnesota has received grant money to do programs for people that are Medicare beneficiaries and Medicaid beneficiaries. In fact, there's a research study, so we're in the process of recruiting people that receive Medicaid insurance and Medicare. There are programs that can be provided for free. We also have another program through HealthEast. It's called Diabetes Prevention Getting Started. It's a shorter program. It's two-hour sessions, and we talk about healthy eating and how to get how to become more physically active. So we have a lot of options for people.
And who's eligible, I guess, to participate? You mentioned the Medicare and Medicaid, but other than that, what would be other criteria?
Well, and we're working with our public policy so that there is more insurance coverage for diabetes prevention programs. But at this point in time, we do have a community-based program that's eligible for anyone if they have any concern about their blood sugars. That's the 4-hour program, and we show people how to test their blood sugar and talk about healthy eating and exercise, and they go for a couple weeks and actually test their blood sugar before and after they eat and really learn what different foods, how that impacts their blood sugar, and also exercise. Exercise helps to decrease blood sugar. I had mentioned earlier that part of the problem with type 2 diabetes is insulin resistance. And one of the pieces for combating insulin resistance is physical activity. So the more active we can be, moving our muscles, that really can help. Probably the best remedy for treating insulin resistance is to become more physically active.
And I think I had read also, too, that it could be something as simple as just standing more versus sitting. Just that whole act of just standing.
Yep, I know there are some programs where you can even stand at your desk if you're working, or when you're on the telephone, if you can stand more often. So anytime you can be more physically active and moving your muscles, it all helps.
I remember, I think it was NBC had some program where they were talking about things like that, and they were saying, during the next commercial break, do something.
Yeah.
So I was doing that as well, and then they said, well, you only burn so many calories, but the whole point was just to get moving.
Just to get moving, yes. And here in Minnesota, it's a challenge. I, over the weekend, tried to take the dog out for a walk, and it's wet and it's icy, so I think we have to be very careful about that. But there are great indoor places to walk, the mall, you can walk in your apartment building. But in Minnesota, we really do have to have a thoughtful plan about maintaining our physical activity.
And I know that you've been involved with diabetes prevention and education for a long time, and you have personally seen where making these lifestyle changes, losing some weight, getting more active, have had some great positive results.
Yes, and I have been a diabetes educator for 20 years, and so I have worked with people over many, many years that already have a diagnosis of diabetes, and it's a debilitating disease. It takes a lot of effort, healthy eating and taking medication and trying to be more physically active, and if we have an opportunity to catch people if they have pre-diabetes, we can really change the face of diabetes in our community. So I'm hopeful that we can really identify people that fall into that category and that they're interested in learning more about the programs that we offer.
So, and not only will it change the course of not getting diabetes,
Yes.
but those that may already have it can get off insulin or off medication. And
yeah, we work with, if you've already had diabetes, once the diagnosis is made, there's no going back. It's a chronic condition, and people that have diabetes can live very healthy, but it takes a lot of work. You have to pay attention to it every day. There's no vacation from diabetes. They can be very healthy people, but it takes a lot of work to maintain that health. And diabetes changes over time. So blood sugar does progressively go higher. So it's very important that people are seeing their doctor at least a couple times a year to make sure that they're on the right medication.
Yeah, and at the top of the program we were talking about some of the health ramifications of diabetes. Is just staggering.
Right.
It's heart disease and strokes and just a whole myriad of health problems.
Right. Kidney disease and lower limb amputation, because diabetes, high blood sugar over time can cause multiple complications. So as I mentioned earlier too, with that, with the progression of diabetes and identifying people before they cross that threshold with their blood glucose is paramount.
Why is HealthEast so invested in these launching, expanding these programs?
Well, HealthEast did a community health needs assessment last year, and we talked to focus groups, we looked at public health trends, we looked at population trends, and identified that we have a growing, diverse population. Our community is getting older, and as we get older, we're at much greater risk for chronic disease, and diabetes is one of those. And our CEO has identified that diabetes prevention is one of our pillars, one of our stake in the sand that we're really wanting to impact our community.
And even some of our special populations in the community, we're seeing an increase in diabetes as well.
Yes, there's a great increase in diabetes diagnosis with our Hmong population and African American population, our Hispanic population, so diabetes is even at greater risk in those populations. So we've got some real special programs that we're identifying, building in the community to help those communities.
So will you be having some screenings coming up where people can find out if they're at risk?
Yes, and the diagnosis for prediabetes, let me mention that too. Fasting blood sugar is the blood sugar first thing in the morning. Diabetes diagnosis is if it's 126 or greater. If the fasting blood sugar is between 100 and 125, then that's when a pre-diabetes diagnosis is made. So a healthy blood sugar should be less than 100 first thing in the morning. And there's another test that can be done. It's called a Hemoglobin A1c. That's an average blood sugar.
And that's a longer one, isn't it?
That's a longer one over the 2 to 3 months prior. And that's another simple test that the physician can order. And that should be less than 5.7. If you are in the pre-diabetes range, that will be between 5.7 and 6.4. Diabetes diagnosis.
So that shows long range your risk, or
right? It's the average blood glucose over the past couple of months. So if you haven't had that blood test done, I would encourage you to go back, see your provider if you've got some concern about it. Ask for it. Right.
Yeah, that seems like that would be more an indication of that you're on the track for prediabetes or diabetes?
Yes, yeah, that's a common. And so we do have are offering some screenings in the community where we are actually going to be doing a hemoglobin A1c test in the community to help identify people that might be in that range. So if you have a family history of diabetes, if you have a parent or a sibling with diabetes, that puts you at a greater risk. And I mentioned this before, if you're not very active and if you're overweight, that puts you at risk. If you were diagnosed with gestational diabetes, that also puts you at greater risk. Or if you had a baby that weighed more than 9 pounds, that also puts you at greater risk for getting diabetes.
So if someone wants more information, how would they go about doing that?
I would encourage people, they could call me directly. I am responsible for our diabetes prevention program at HealthEast, and I can answer any questions that people have and get people into the right program depending on what their insurance is or what their situation is. I can help facilitate getting them into a program. We also have a partnership with the YMCA. The YMCA also offers diabetes prevention programs, and so we work in partnership with the Y and the Lions Club. Also, we have a partnership with the Lions Club to help.
I should give full disclosure, we're both in the St. Paul Diabetes Lions Club.
That's right, and we did receive some grant money to help build our diabetes prevention program, so we're very grateful for those funds. The HealthEast Foundation also has been very generous in providing funding to help get our program started, so we're very grateful.
Final comments for our viewers.
Well, we have a tremendous opportunity to decrease the diagnosis of diabetes. It's epidemic today, and this Centers for Disease Control program that we are embarking on for HealthEast is a great opportunity to decrease your risk. So I hope that my phone is flooded with calls. People, if they have any questions about it, and I would encourage people to get to their physician and have the blood glucose done. Have it checked.
It could save your life.
It could save your life. Yeah.
And one more time, the number to call?
651-232-5444.
Well, thanks, Marsha. It's always a pleasure to have you with us.
Thanks, Jody. Appreciate it.
Still ahead, something that you need to know before your next hospital visit, so stay with us. Thanks.
Thank you.
Lead paint poisoning affects 1 million children today. If you're pregnant or have young children and your home was built before 1978, you could be at risk. Learn how to protect your family. To find your home's danger zones, the health effects, or just to find help, log on to leadfreekids.org.
Welcome back, everyone, to Inside Healthcare. Joining me now is Dr. Craig Svendsen. He is the Chief Medical Quality Officer to talk about patient safety awareness before you go to the hospital next time or to your clinic. So we've talked in the past about how Minnesota, Upper Midwest, we have some of the safest standards, quality here in the whole country, or one of the best in the country.
We do.
So what are still some of the concerns that you have that we have here in Minnesota about safety awareness?
Certainly. Well, no matter how safe one is, we're still not as safe as we can and should be. So, some of the concerns that still linger out there, if you will, that we continue to work on include things like safe site surgery and safe surgery processes in general, safe medication management, and then looking after, bed sores or pressure ulcers, if you will. And the last one that comes to mind is patients falling while they're in the hospital.
Very common,
And in the most recent report that was published in January from the Minnesota Department of Health, Minnesota Hospital Association, again, patient falls in the hospital remains a significant issue for all of us in the hospital.
Maybe you can talk a little bit about that report that comes out every year. what it's all about, what are the things that are reported in it, and why Minnesota, why the hospitals do this?
Certainly. Well, first off, it is a state law that these kinds of events, there are 28 serious adverse events that need to be reported by any of the hospitals or surgery centers and reported publicly. The report comes out once per year. It's published in January. This was our 9th year in a row of publishing this information. It's very unique in the sense that when you look around the country, very few states, if any, do this public reporting. What's really special about this is it then allows all of us in the state of Minnesota, hospitals, clinics, doctors, to try to understand why is it that these events are occurring, put in place certain steps to try to prevent them from happening, and improve the safety and care of the patients that we're serving.
So what has happened over those 9 years since we first started reporting these events?
The total number of reports, in thinking of this year and last year, the total number of reports has remained constant. We've seen that the frequency of bed sores or pressure ulcers has been decreasing with the interventions and the steps that we have taken to help prevent that. On the other hand, patient falls continue to be a problem for us, and in fact had an increase in the past year.
So what steps are being taken to try to reduce those or prevent those?
Well, for every patient that is in our hospitals, or really many hospitals around the state of Minnesota, an assessment is done, trying to determine how likely is it that a patient will fall. Are they an 18-year-old young male? Are they a 90-year-old elderly person? Different likelihoods that they'll fall. Also, are you in for a surgery? How sick are you? What medicines are you receiving? So all of that goes into an assessment so that we know how likely one is to have a fall. That said, then we need to try to prevent it from occurring. Things that we will do include checking on the patients more frequently. And every hour to 2 hours, stepping into the room, asking the patient, are they okay? Do they need to get up to go to the bathroom? Are they comfortable? Mm-hmm. And if they need to get up...
Because that's when they're likely to just get up and get out of bed, not realizing they're on these medications and they're not, don't have their balance and things like that.
Exactly. And, most of us have never been in the hospital, or when we're in the hospital, haven't been receiving the medications that we receive. And so you really don't understand, as patient, what that medicine's doing to you, how unsteady it may be making you as you get on your feet. So when the nurses ask you, ring that buzzer when you want to get up, take it to heart and indeed call for the nurse to help you out of bed.
What would be some other things that patients should be aware of before they're going to go to the hospital, when they're in the hospital, or when your loved ones may be in the hospital?
Well, first and foremost, my favorite is a medication list. As patient, everyone should have an accurate list of the medicines that they're taking. And that list should really include what you're actually taking. Many times there'll be that list, and my patient comes in to see me and they say, yes, I'm taking all 12 medicines that I have listed out on their med list, but actually they're only taking 9 of the 12 and they don't want to share that information with me. It's very important to have the list of the medicines that were prescribed and then also share with us which ones you don't always take because maybe they don't make you feel too well or whatever. That list should come with you to the hospital, should come with you to the doctor, everywhere you go. That also gives us the opportunity to change the list when you leave the hospital. After you've had your office visit, it allows the physician or the provider to make changes in that list so it continues to be accurate, so you can continue to share it everywhere you go for your health care.
And should that list also contain perhaps some supplements that you might be taking, or I don't know, some of the alternative type things that aren't your prescription?
It would. It would be best if it contained all the items that you're taking, whether they're vitamins, minerals, supplements. Many of the supplements will interact with our prescription medications.
Make them ineffective?
Make them ineffective or make them more effective, or just enhance the side effects of the medicines. So really having a complete and thorough list would be the best.
What would be other things that people should do before they go to the hospital or when they're in the hospital, besides medications?
Besides the medications, really knowing what it is that you're going to the hospital for, circling back to my comment about safe surgery. Many times a patient shows up in the surgery center and they're asked, well, what surgery are you having? And they'll say, well, the surgeon is doing something with my knee. But really you should know, why are you having the surgery for that knee? Do you have something wrong with the cartilage or the ligament? What exactly is the surgeon going to be doing? So really asking that question, getting an understanding of exactly what it is that's going to happen. That will help the surgery center immensely. Yes, we have the order from your surgeon. We think we have the right procedure scheduled. That said, we also want to hear from you. What did the surgeon tell you that you were going to have, so that we can be certain we do the right procedure to make you better?
And I know the hospitals, before surgery, they mark the body part that's to be operated on and things like that to make sure that they're operating on at least the right site. And that I had surgery in December, actually. So I know I was really cognizant of making sure it was my left shoulder that they were going to operate on.
Yes. Yeah, we do physically mark the location of where the incision is going to be or where the surgery is going to take place. And so when you come into the surgery center, we ask you, what is it that you're going to have done? We check the records to see what the surgeon ordered. We complete a consent form that, again, identifies which side we're doing, left or right. And then the surgeon comes in and marks the spot where they're going to make their incision when they actually do the surgery.
And other steps you might take in our final comments here about?
Well, the final comment I would make is encourage everyone to bring someone with you when you're going to your doctor, when you're in the hospital, and especially if you have an overnight stay in the hospital. Make sure that there's someone there with you. Again, a lot of technical speak comes at you that you need to try to understand, ask questions. When you're in the hospital feeling poorly, you're receiving medicines that cloud your thinking, you need someone else there to help understand what's going on while you're in the hospital.
Yeah, even if you think that you're alert, you may not be as alert as you normally are.
Exactly. So,
well, Dr. Craig Svendsen, it's always a pleasure to have you with us. Thanks for joining us.
Thank you, my
Great
pleasure.
information.
Thanks.
Thank you. And we'd like to thank you for joining us. We hope you'll join us next time on Inside Healthcare. We'll see you then, everyone. Thanks.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.